Hello, my name is Mia Pickard, and I am doing the Go Fish pitch for the OnMed telehealth kiosk. I came across this idea at a telehealth conference. I'm a telehealth nurse, and during that conference, I have to say I was really impressed with this product in that it would vastly improve some of the access to care for our veterans, especially in the more rural areas. Anyway, just to explain, it's primarily for those patients with life-threatening conditions like colds, rashes, fevers, and things. But you can also use it for fitness and wellness programs. It doesn't take the place of a primary care physician. Um, that type of visit, but it also can the results of the visit and the notes can be securely transmitted to the physician via the EMR. So here's how the product goes. If you can imagine a freestanding kiosk, sort of Star Trek like, I would say, it has a self enclosed exam room, and it has these kind of features. There's like, as you walk in, the door locks, and it is as it locks, the glass that encloses the kiosk is switchable opaque glass, and that ensures patient privacy in case others are around. There's also ultraviolet lighting that ensures all the surfaces and the air within the unit are sterilized. Um, there is also like a 3D facial recognition so that patients can be adequately identified. Imaging is a tool so that they can get body temperature and diagnose infections. Like if a person has an affected wound and it's warm to touch, it can detect that as the patient is sitting there. There are tools like to capture weight and height, as well as blood pressure, as the patient is sitting there. There is high definition video and audio so that the doctors can inspect the patient vitals. And there's also like a screen that, as the doctor is examining them, say for instance, they are viewing their throat, the patient can also see what the physician sees, so that patient teaching can be done there as well. Um, there are as far as medications, if there were like antibiotics or any other kind of medication that might be prescribed during that visit, there is uh, um, a chute or so to speak that would be able to dispense those medications at that time of the visit. Um, as far as payment is concerned, the machine has a card within it that the patient can put their Medicare, Medicaid card, credit card, um, their insurance card, and it all can be taken. Or it can, the service, the on-med service, can be configured so that it charges the VA facility on a per member per month basis, for example. So I'm thinking that this can largely increase the access to care of the veterans, especially when I hear them over and over again talk about how they're not able to get in to see someone, sooner than later because of the distance and things that present to them being out in these far-reaching rural areas. So I'm thinking this is going to be a real game changer with improvement to access to care should they decide to choose this project. Thank you for listening. Bye-bye.